How do you diagnose reflux? Well, the most common test is called an upper endoscopy or an EGD. That's done by administering some anesthesia to the patient and then looking into the stomach with a scope and looking at that valve at the end of the esophagus. From the endoscopy, I can tell from just looking how big a hiatal hernia is if they have one, and almost surely they do because that's what's causing their reflux. I can tell the extent of the reflux, how severe it is, by looking and doing biopsies of that lower esophageal lining where the changes have occurred. Usually in my hands, that's the only test that needs to be done. So if a patient has or believes they might have reflux, let's say they have a chronic cough, or they have asthma or just heartburn, then they should have an EGD done. Most of the time, realistically, patients won't just come to me as a primary care doctor. They will have been diagnosed by ENT. Their cardiologist will say you don't have heart problems. Their medical doctor will have started them on PPIs. Many patients, if they go to a GI doctor, will get a 24-hour pH where they put a probe down into the esophagus and measure how much acid comes up. The problem with that test is that probe is placed about 5 centimeters above the junction of the esophagus and the stomach. And they can't always tell where that is because the lining changes. So it gives a false negative in a lot of times. Plus, it can be negative 5 centimeters above there, but we really need to know what's happening right above the stomach. The other test that patients might have to have is a manometry test where you measure the effectiveness of the esophagus, the contractions, the motility of the esophagus. Patients who have chronic reflux actually can damage the muscle of the esophagus and it will actually quit working. That's usually a very severe case. But esophageal dysmotility can occur due to reflux, or it can occur as a result of muscle disorders or nerve disorders of the esophagus. So we do need to rule those out sometimes. But usually the main test is an upper endoscopy or an EGD.